and survive, or to receive an education, or have, healthy and safe environments, or to feel some kind of protection. That's exactly what we're doing, is we're failing our children. And much like in developing countries, I think we are in such big trouble because we continue being left behind because we're not prioritized. And the sad thing about our children is that, when we talk about the SDGs directly impact our children, yet we continue to leave them behind. I think you raised such an important thing when you were saying that, the way forward here is to actually ensure that, we work with our young people. And I think that's a very important message to, to convey to our leaders and to our donors, to say they really need to pay attention to our children, and they really need to work with our children in order to deliver on adolescence.
Thank you. David, would you just give an answer to that question? How do we ensure that we bring everybody on board? And especially as we work towards the Global Summit in 2023, and we are calling for all the youth to participate. How do we ensure that the youth in DRC Congo, or in South Sudan, or in areas where they are under-resourced, are on board as we work towards 2023 and beyond?
Yeah, that's an excellent question, Mercy. And I think that beyond thinking about just countries, I would say that even in developed countries or middle-income countries, there are huge inequities in access to information, to services, and so on. For example, I was working in the Amazon rainforest in Ecuador as a medical doctor. And of course, I mean, people there don't know about SDGs. They don't know about like global actions, call to actions, and so many things that we talk like, and as normal things every day. So my question is like really like getting into like the local people through, for example, local governments. There are many mechanisms that we can take to ensure that that people in this like the last mile, let's say, that can access to this kind of information. For example, yesterday Helga was mentioning during the plenary about citizen hearings, parliamentary hearings, reaching out to media. There are so many things that we can do to make sure that we can access this, to make sure that young people in these remote locations can access to this information. And it's an issue of inequality and inequity, unfortunately, that we have to address first in order for us to move on in the global health agenda. Otherwise, if we do not address the systematic issues that we have around the world, racism, issues of inequality, of income, social class, and so many more, we will not be able to address the health issues that are affecting the communities in the local level.
Thank you, David, and thank you, Zoleka and David. I think I will end that there, but just to let all of you know that David and Zoleka, as much as they are exiting the virtual stage, they're not exiting the Zoom call, so they will be here to answer any questions you have. So please, let's engage in chat. If you have any questions for these two, please let us know. But as I wait for that and as we move ahead, I want us to go back to the poll questions. I said today we must test our awareness of issues relating to young people. And I have 4 questions for you. Winnie, if you can launch the first poll. And we're asking, what percentage of young people globally reported good emotional well-being? What do you think is the percentage of young people globally that reported good emotional well-being? Winnie, can we all see the poll now? All right, poll still not working, so we leave it at that. But let me just, address this question that I've asked now twice. We're talking about well-being of young people, but we haven't, the argument is we may not have asked the correct questions to these people. This poll has 3 answers. I would have shown you like 3 answers: 10%, 30%, 50%, and 80%. Now, the correct answer is that just under a third of young people have good emotional well-being. That is 1 out of every 3 persons. And then those are the people that feel they don't think about their problems too much, or are not currently feeling anxious, bullied, unloved, or lonely. But look at the bigger percentage, like how many are we living out of these? 7 out of every 10, like 7 out of every 10 persons has, I can see there's a poll on your screen now. What percentage of young people globally reported good emotional well-being? Yeah, I can see the answers coming in. Oh, it's because I told you the answers. So most of you are saying, okay, all right, okay. Well done. Wow, those amazing responses. 30%, yes. 14 people, 15 people. Okay, let's end it at that. About 16 of you, 76% of the people who participated in this poll say 30%, and that is the correct answer. But the other people who gave the other figures, 10% and 50%, you know, the person who said 50%, it's not 1 in every 2. It's only 1 in every 3 persons, meaning, oh yeah, the numbers are still coming in. Yes, so 7 out of every 10 youth or young people still feel that they are not at a good state of mind emotionally, and that should be a concern for us. And I will go to the next poll question. I'm not giving you answers for this one right now. We have to answer it fast. And the question is, I hope we can launch this one on time before I give the answer. Who or what did young people consider as the single most influencing factor in their lives? Winnie, let's go to the second poll question. Yeah, we've closed that one. The second poll, who or what, exactly, there it goes. Who or what did young people consider as the single most influencing factor in their lives, good or bad? Great, guys, let's participate in this. I'm encouraging all of you to let us know your answers, because that is the only way we know where and how to move on from here. Wonderful, wonderful. The results are coming in. 44% of you say, I'm ending the poll in about 5 seconds. Winnie, we can end the poll in about 5 seconds so that we are not behind time-wise. Okay. 45% of you say their parents, 32% say their friends, and 23% say the internet. Now, their answer is 89% of young people globally say their parents influenced their values a little or a lot. Their parents. It's not their friends, not their teachers, not their internet. So we should ask ourselves at home, what kind of environment are we creating for the young people? The moms, the dads in here, the big brothers, sisters, aunts and uncles who are joining us today. What kind of environment are you creating for the young people in your household? Keeping in mind that 89, that is about 9 out of every young people say their parents influence their values a little or a lot. If you are a guardian, if you are a parent, I think that is something you should really reflect on. Number 3, the next poll. What was the percentage of young people? What was the percentage of young people reporting good physical well-being? The first one was emotional well-being. What was the percentage of young people reporting good physical well-being? Again, running ahead of time, we need to really hurry up on these. Thank you. Thank you for taking part in these. 33% of you, about 30% of you say 60 to 70%. 30 to 40%, about 52% of you. Now, we have failed terribly on this. Let's end this poll. Winnie, let's end this poll and share the results. Yeah, a majority of us said 30 to 40%, but the answer is A, 15 to 20%. Actually, the exact answer is 17%. That is the percentage of young people reporting good physical well-being, 17%. That is about 1 in every 10 young people. Hello. That just shows how important the discussions we're having today are, because we are not even, conversant with what young people are going through. And I hope that this is, again, a wake-up call and really channels us, or, just helps us to, when we go out there, to advocate for young people, talk to young people, know what they want, and really push for their health and well-being. Our last poll is, what percentage of young people reported that making a wider contribution to society beyond themselves and their family is important? What percentage of young people reported that making a wider contribution to society beyond themselves and their family is important? Again, let's do this really quickly. We are running out of time, and I will tell you now the answer to this. All right, 40% of you, actually a lot of you are saying 80 to 90%. Unfortunately, that is not the answer. Let's end the poll. The answer is C, and the correct percentage is 66%. Only 66% of young people reported that making a wider contribution to society beyond themselves and their family is important. Let's reflect on that. And just to remind you that, you know, this this survey was taken in 2017. And given the COVID-19 pandemic, it is likely that the situation has been greatly exacerbated. And that is something we can discuss for hours on end. So please keep the conversation going, even out of this forum into social media and in our social settings. Let's talk about the young people, not those poll questions, and reflect on what the answers talk about. Now, I will move to our next stage of the next panel for this discussion. And it is a beautiful mix of individuals that will help us dissect the concept of well-being with reference to young people. But most important, how do we define, program, and measure adolescent well-being, or rather, what is well-being? And to help us define that, allow me to share this screen. I don't know if you can all see my screen. That is the definition of adolescent well-being. And this is from the UNH6+ Technical Working Group and other partners, including, you know, representatives of youth-led and youth-serving organizations. And they defined well-being as a state where adolescents have the support, confidence, and resources to thrive in contexts of secure and healthy relationships, realizing their full potential and rights. And to achieve adolescent well-being, we need to work across 5 domains, and I hope you can see them on the screen. These are the 5 domains we're talking about. We need to work across 5 domains that are interconnected, and these are good health and optimum nutrition, connectedness, safety and a supportive environment, learning, competence, education, skills, and employability, and agency and resilience. Now, keep in mind that these domains are interconnected and one cannot exist without the other. Already there is some great work going on to unpack the concept of adolescent well-being in practice as a means of improving our, you know, an important resource for policymakers, program managers, and practitioners. And today we have paired up youth leaders and experts who are leading on this work. And I will invite them on stage shortly. Each pair will address one domain that I've shared on the screen. And without, you know, going into many details, we'll start with Chiamaka Nwachuku and Valentina Baltag from WHO, who will address domain number 1 on good health and optimum nutrition. And I will start with you, Chiamaka. Please unmute yourself. Please put your video on. Why is this domain number 1 so important to you?
Okay, thank you very much, Mercy, and thank you, everyone. I'm glad to be here. Good health and nutrition, I believe, is the foundation of all of the domains that we're talking about in terms of adolescent well-being. Now, there are 2 major stages of transition in a person's life. The stage between when they are in their mother's wombs and then they come out, so that transition between extrauterine life, and then the stage between when they're transitioning from childhood to adulthood, the stage of adolescence, which we're talking about now. So I'm a medical doctor and I'm also a young person, and there's something that I noticed. So adolescent well-being seems to thrive in that gray area where they are too old to be children and too young to be adults. So we tend to see that the interventions being to this particular people not need for respect their privacy, several other reasons find important. So hospital I work, adolescents are nursed in the open wards with children that are 3 months, 5 years old. It's really uncomfortable for them because they say that they do not believe that they are supposed to be in that particular kind of place. And we understand that the mental well-being of these young people is also important for their health and well-being. So, and even their physical well-being as well. So, in addition, I have noticed that at this stage of adolescence, young people are also supposed to sacrifice access to good nutrition, education, and essential healthcare services for the good of either the younger children at home or the adults in the family. And I see that many times in clinical practice. So a mother has a 2-year-old who gets sick and they come to the hospital immediately, but a 13 or 14 or 15-year-old stays at home for long, and then they try all sorts of remedies before, and they ask them to be a big girl or be a big boy, and then by the time they're getting to us at work, they have gotten to stages where it is very problematic and we cannot deal with that. So it has become important for us to have adolescent responsive healthcare systems, and Dr. Valentina is here to shed more light on what exactly it means to have an adolescent responsive healthcare system, because I see many times that we talk about interventions for adolescents, especially where I come from, it seems to just be limited to sexual and reproductive health rights, which is crucial. However, this is not the only thing that needs to be considered when we're looking at a holistic responsive healthcare that takes care of the well-being of adolescents, both mentally, socially, and physically. So Dr. Baltag, I would now have you go on and talk about, where are we in terms of adolescent well-being, what needs to be done on local, regional, and global levels.
Thank you, Chamaka. And it is very insightful to hear from a young doctor how the services, the way they are organized, do not meet the needs of adolescents. The term adolescent responsive health systems, we started to use it more intensely after 2014 when we published a global report. And already back then it was clear that approaches that look or try to design some adolescent specific or dedicated services, but not looking into strengthening the core functions of health systems so they serve all adolescents wherever this point of contact with the system is, we're not at scale. So adolescent responsive health systems basically means that you have a trained provider, adolescent competent providers, that you have adolescent protective health financing and financial protection policies, that you have adolescent mindful health management information systems, and that you have quality of care and service delivery platform that reach adolescents with preventive services, anticipatory models of care. Now, there is no time to describe all the policies, but I want to alert the audience who is listening here that we are developing a paper, and this will be published, to describe what does good health and optimum nutrition means, and more importantly, what are the key policies, the low-hanging fruits that we can implement already now that can lead to this good health and optimum nutrition. But I want to also reiterate that good health and optimum nutrition, this is, as we said, one of the 5 domains. Responsive health systems is not enough. We need actions beyond health systems, and there are many sectors that can contribute. I want to emphasize the role of 2 sectors, the education and social protection. For example, complex interventions like health promoting schools is about good health and is about making education system to integrate health related consideration and health promotion, not only seriously, but making them part of the core business of the education system. So again, this is a paradigm shift. Chamaka, your example of giving up food for younger children, it's another example how broader policy, even beyond the one single sector, such as, for example, household food security, are so important, because if food is scarce, we know already from personal experience, but also from what is being documented, that adolescents are likely to suffer. And my final point is that we need actions beyond the health and nutrition domains. It has been said, but I want to, because in a good health and optimum nutrition, there is, of course, this, so to say, negative part. Good health is, of course, the absence of physical and mental disorder and disease, but it is also this intrinsic capacity that makes the individual capable to restore good functioning and to access external resources. So it's not only about not being ill, but when you are ill, or to anticipate than to be able to access the existing resources. It is also about coping well with daily tasks, for example. And here where the good health and optimum nutrition domain links with other domains. Take, for example, the timely care seeking, which is purely health-related behavior, but without agency, which pertain to other domains, you cannot have proper care seeking because you need to be ability to self-direction, ability to make meaningful choices. Or
Valentina, let's wrap up, please. Let's wrap up.
I'm wrapping up. Core
Yeah.
to care seeking is also the education, so the role of the education. And I will stop here because that's, I think, a good moment to describe other domains. Over.
Thank you very much, Valentina and Chiamaka. And I will go to domain number 2 without, any further ado. And Sarah and Ranjali will have a conversation on connectedness. The floor is yours, Sarah and Ranjali. Sarah Thompson from the UNICEF and Anjali Singler.
Thank you, Mercy. Yeah, Anjali and I have had some really valuable conversations about connectedness, and I thought we would just continue to have that conversation and explore some of these topics. Anjali, we've been talking a lot about how connectedness is about having positive bonds with people and institutions. And that these are then reflected in exchanges that develop relationships. And we know that young people who feel connected to their peers, their family, their schools, or other community spaces and organizations are less likely to experience negative health outcomes, substance abuse, poor mental health, violence, risky sexual behavior. And you are very active in your community, you're a mental health professional yourself. And I would just love to hear how you see connectedness as being important for the communities that you work with.
Thank you, Sarah, for that question, because like you said, the essence of connectedness lies not just in these positive bonds, but the reflection of these ideas and thoughts in the intervention or any work that we're doing with the community. And I always like, whenever I'm in the community, I like to say, I'm not here to work, in your space because things are wrong. I'm just here to learn from you, what are your needs? Because when we take that perspective that you take us into your world, because we don't have that lived experience. And I think connectedness comes from a sense of authenticity, that being honest, that yes, I will never understand what your life experience has been, but I can hold space for that and I can let you lead. And I think with that, it cultivates a more collaborative approach. And that is where, connectedness is sort of translates into the work that we do with communities. When we tell our young people that you have the agency and you have the insight to recognize what is working for you and what is not, it is always more productive, and it is almost always more genuine in the work that we do.
We've also been talking with our colleague David, another youth leader from St. Lucia, who's told us that many young people he knows don't feel like their opinion matters. So they don't get engaged in their communities or in political processes. Do you recognize that in your community in India? And what do young people need from adults and duty bearers to make that happen, to make that sense of connectedness?
I agree with David, because in my culture, we have fixed rules that if you're going to college, you're going to study. You can't, for example, be a part of the student union, or you can't be a part of a volunteer group. That it's difficult to convince our parents that, yes, I can do multiple things, for instance, right? And it's almost looked down upon that don't deviate from that rule. So, and I think, as David here was talking about, privilege. I think that comes in, that is very, very relevant as well, because not everybody has the same social resources and the power dynamics that they come from their communities to speak up. For instance, over the past years, I feel that in my country, young people from marginalized communities have been failed by the
sort of structural systems, whether it's a judiciary or the social support networks. It's almost that we have disenfranchised people, young people from marginalized communities, to come out and speak because there is fear, and there's our work is not seen as work. It's seen as a starting step. We are giving you this job because of for experience, not so the pay is not good. What is the incentive for us to stay in the community and work? I think so for the adults, it would be that see our work as work to begin with responsibility, give us accountability. Don't just sort of give us a seat at the table, give us spaces and give us roles that actually have space to implement little projects or a voice that is heard and reflected in these dialogues. And the other thing is challenging.
Let's wrap up because of time.
Thank you.
No,
so, but
don't panic. I know for these things we can talk on and on and on because they're very passionate and important to us. But
I just have one question for Sarah. That because including young people is new in such scenarios, how is UNICEF adapting, and what are the learnings?
Well, it looks like we're kind of out of time. I would love to answer this. Maybe if there's time in the question answer period.
Thank you very much. And also you can, if we don't have time, you can just start typing your answer on the chat box. Let's utilize that function because all of us can see it. So yes, please, we can go that way so that we give other people time to also contribute. And now I will go to domain number 3 on safety and a supportive environment. And here we have Omnia El Omrani and Savika Chalasani from UNFPA. And I'll start with you, Omnia. What does the domain mean for you?
Yes, thank you so much. And I'm very happy to join you all today and listen about the 2 important domains. When it comes to having a safe and supportive environment, as a young person, I always feel a deep sense of uncertainty and insecurity. Why? Because of the lack of prioritization of ensuring that the environment that I am in is safe and supportive. Many youth and adolescents like myself feel unsafe every single day due to exposure to violence, abuse, exploitation, and injury at home, at school, or on the roads. Road traffic injuries are the leading cause of death for young people aged between 15 and 29. Every day, more than 3,700 people die on the roads, and more than 1,000 of them are young people. At the same time, this year, I lost 2 of my friends in a road crash. In my country, in Egypt, it is uncommon for us not to have at least lost one of our loved ones to a road crash. In addition, since this webinar, we're also addressing the COVID-19 pandemic, and it has further exposed the challenges that we face as adolescents and youth by being forced into lockdown into the same environments that we feel unsafe in. And we have conducted a survey with WHO that was answered by over 1,000 young people, and more than 58% of them expressed that their mental health has been negatively impacted. And they expressed the need for having safe spaces for talking about how they feel, for validating their mental well-being and needs, and for the compromisation of their prospects of leading a rich and a fulfilling life. But at the same time, as a young advocate, I always felt inspired. I'm currently part of a global youth coalition for road safety as a youth advisory board member. And I co-chair the World Youth Assembly that gathered youth from all over the world, from over 100 countries. And this assembly, we demanded a safe and a sustainable transport system that puts our needs at heart. And that is why this year, at the end of 2020, we conducted a global campaign that called on a mandatory lockdown for young people for our safety and well-being, to protect us from the risk factors that are leading to our death. And we had the participation of over 1,000 young people from around the world. I also witnessed the tremendous efforts that are led by young leaders demanding a meaningful and sustainable space for youth to shape their surrounding environment, the environment that influences their health, their well-being, and their development. As youth, we simply ask for a platform to be treated fairly, to have equal rights, to practice our beliefs, freely express our identities, to have privacy, to have the capacities for self-protection and the opportunities to thrive. But we also have a strong role to play in shaping such policies and frameworks that ensures the implementation of such frameworks on a governance level. And there are many meaningful examples and best practices for this space that are given for youth that we need to share and we need to amplify. For example, I'm currently working with PMNCH as a young co-author to shape a background paper on safe and supportive environment. So right now, I'd like to give the floor to Sawitka to take it from there.
Thank you so much, Omnia. And we can see that you're a passionate advocate, and you've come through in so many fora, and you've still been active. The pandemic has not stopped you. And that's what's amazing about, I think, young people and their energy. They've just found opportunities, even when they've been taken away, to keep going on these issues that are so fundamental. I just have sort of 2 points to make today. The first one being that safety as a domain of well-being, the reason it's in there is because it's as fundamental as food, as addressing hunger, as nutrition. If you don't feel safe as a person where you live, in a home which is supposed to be safe, or in the streets where you have to move, or a school where you're supposed to be learning, or a workplace where you're earning, to support your family, then you cannot be whole as a person, and you cannot feel like you own your life or you're in control of your destiny, because there's always the threat of violence hanging around you. And it's not just violence, and that's why we've expanded this domain. And that's my second point. The way we've structured our understanding of safety is to say there are personal and interpersonal risks to safety. That includes things like intimate partner violence, gender-based violence, sexual violence. It includes school violence from peers, from teachers. It includes gang violence. And it also includes suicide, the risk of self-harm. Then we've had the next category, which is the risks to your safety from your material environment or your built environment. And Omnia has talked a lot about road traffic injuries and road safety, but also in your home, if you're, using like a wood burning stove and the smoke, and what does it do to you? That's also a sort of an issue of safety and well-being. And then finally, the third category of risks to safety that we've talked about are the structural, institutional, or collective risks to safety. I am from India, and there we have a hierarchical system of social organization that began as an occupational system, but has today transformed itself into something else, which has resulted in the oppression of certain groups of people. And that it's what we call sort of collective violence against certain groups of people. There are restrictive norms, there's restrictive, dynamics, which prevent people.
Let's wrap up, Savika.
Sure. And so I think I'll just close by reiterating my message that safety, is as important as these other domains. And if you do not feel safe, you cannot thrive. Thank you.
Thank you very much. And now we go to domain number 4, where we'll have Desmond G and Sally Biddle from the UNESCO. Please, you each have about 2 minutes to just tell us about, learning, competence, education, skills, and employability. Desmond, what does this mean for you? And how can you, Sally, support what Desmond is demanding for?
Thank you, Mercy. I've been a health and well-being communicator for 17 years now. I started when I was very, very young. I recollect a radio intervention I had on Cameroon radio and television, where I was invited to talk about sexuality education in line with the projects we do. And we got a call-in contribution amidst the shame-based nature, as it is for the most part considered, sex and sexuality. The caller said, and I quote, "Your program is timely. I'm in support of the notion that sex education should be included in the school program. Madam, believe me, the rate of pregnancy among schoolgirls is alarming. I invigilated an end-of-course examination in one of the accommodation centers in the country, and I noticed that about 100 girls of the Form 5 class of that center were proudly pregnant." Now, these are some of the realities we experience on the ground. The issue here is that some of these girls are not biologically ready to handle pregnancies, and they are also highly likely to drop out of school without obtaining the end-of-course certificates. Sex and sexuality are, for the most part, considered shame-based, but we need not forget handling this properly in order not to deprive ourselves of the required health and well-being knowledge and skills. And I think adolescents have the right to education in general, curriculum-based education and holistic sexuality education in particular, because of the so many values they can obtain, along with the skills and competencies that they need to deal with the day-to-day affairs. I'm not also forgetting one of the key elements of the domain, which is employability. It is an aspect which is also sharpened by the right skills, values, and human relationships, something which curriculum-based education richly offers. Directly linked to the background paper on the domain, I contributed cost effectiveness evidence for curriculum-based sexuality education, and it proves economies of scale on the implementation side. And it also contributes greatly to the reduction in the costs of HIV infection, including the treatment, apart from the psychosocial, emotional, and other benefits. And in order to expand access to age-appropriate sexuality education in Cameroon, these are our local actions, we developed the Adolescent Health and Wellbeing Package, consisting of a manual for, okay, all right, I would just,
so that Sally responds to some of the very important points you've raised about, sexuality and education in the part that I really want her to talk about, what UNESCO is doing to address the really important points that you have mentioned. And then you can tell us on the chat what you are doing in Cameroon to address the issues you've raised.
Awesome. Yes. Yeah. Over to you, Sally. Thank you.
Thanks, Desmond, and thank you, Mercy. I mean, look, I would just extend on what Desmond had said about the important role that schools and other education institutions really have to play in promoting wellbeing. And I think the imperative is there now more importantly than ever. It's always been important, but in the context of COVID, we know that many adolescents are having a tough time and schools can really step in to support them. One example is through providing interventions such as comprehensive sexuality education and other curriculum-based interventions. But there are many other things that schools can do to promote a positive school climate, to promote connectedness to school, and to make sure that adolescents have the skills and the education they need to thrive both now and in the future. Unfortunately, despite the evidence and despite the potential that schools and education institutions have to promote wellbeing, we don't often see that as at the centre of their mission, and we really want to move towards that for schools and education institutions to see wellbeing as a really important outcome that they're looking for and something that they're really measuring in terms of the success of education. And we know that there are payoffs there. We know that there are really clear links between education and wellbeing and lots of different interventions that can be invested in to support that. So with the recognition that there's one more domain to present, I'll finish there, but I hope that that gives some indication of the important role that education has to play. Thank you. Over to you, Mercy.
Thank you very much, Sally. And please, we have a few minutes so you can still type on chat anything else you have left around. And now we go to the last domain, which is being handled by Daniel Mollings and Chris Armstrong from Plan Canada. Daniel and Chris, you have about 3 minutes to tell us what agency and resilience means to you.
All right, great. Thank you so much, Mercy. So agency and resilience really ties into all of the domains coming together. Agency is going to be affected by your ability to access education, safety, and then as well as healthcare. So everything really comes together there. I think against the backdrop of COVID-19 and the pandemic, agency and resilience becomes even more important because we're seeing young persons being, kind of kept at home because you're trying to stay safe. Maybe your parents may not want to take you to the doctor because, fear of catching COVID-19, et cetera, et cetera. So really and truly, I'm also seeing that it's being linked now to, technology and access to technology. If I don't have technology during the pandemic, I am no longer able to access connectedness, meaning, connecting with my friends, connecting with my parents. I'm no longer able to access maybe healthcare, and I'm no longer able to access education or so on, which can help to build a foundation for my resilience and agency when I'm older. So agency and resilience is really tying into everything coming together, and against the backdrop of COVID-19 is even more important. Over to you, Chris.
Thanks, Danielle. Really appreciate that, and thanks so much for your leadership and joining us today. I think you've really hit it. We don't like to think of agency and resilience as the last domain. We like to think of it as sort of foundational and at the core of all of the other domains. And I think in the simplest of terms, really at the core of adolescent well-being is the capacity to make decisions, for adolescents to make decisions, and the power to actually act those decisions. And I think you've heard from all of the other domains that really is what drives adolescents' well-being within each of those other domains. Similarly, Danielle spoke about the challenges we faced with the pandemic with respect to agency and I think really what we've learned is the capacity, and I don't think this is a new lesson necessarily, but I think what we've been emphasized is that really the capacity to adapt to the changes or disruptions like the pandemic, like unwanted pregnancies, like STIs, challenges with mental health is really is essential to adolescents to be able to adapt and make those changes and to have the power to do so. I know we're running out of time. We do have a paper that examines these issues that a number of us have been working on, and I know that those papers are going to come forward for consultation and discussion as we lead into this summit going forward. But I want to leave on one point, which is that really what needs to be at the center of all of this is the meaningful participation, meaningful engagement in the leadership of young people. When we talk about agency and we talk about resilience, young people really can't exercise their agency, don't have that power unless adults and leaders are willing to cede that power and give that space to young people. And we're seeing that in this discussion here. We're seeing some amazing young leaders that are able to exercise that agency, but that's not what's happening everywhere. And that message needs to be conveyed, and we need to work with those adults and those leaders to make sure that we're creating those spaces for young people and advancing their agency. I'll leave it there. Thanks very much.
Great. Thank you very much, Danielle and Chris, and thank you very much to the 10 really powerful speakers that we've had for this panel. I know we can talk about this for hours on end, but just a reminder that we are closing this now, and we are calling for multi-stakeholder, multi-sectoral approach to the call to action for adolescent well-being. So please, I'm encouraging all of you to please sign up for the call to action, decision maker, policy makers, and most important, the young people and adolescents. Please, we need to mobilize policy gurus and decision makers to support this call to action. So speak up and speak out. And already we have so much support for it, and we are going to have more support if only we raise our voice and let the people know that this is what we have. So thank you so much for joining this session once again, ladies and gentlemen, graciously organized by the PMNCH. And I hope you enjoy the rest of your second day at the GHPC 2021. Bye-bye.